My name is Steve Samuels. I am a professor at a local college. I had 2 knee surgeries several years back that Dr. Jones did, and it did great, but it left me someone who was very, very active, a little limited. And a couple years later, I went back, and because I'd heard about stem cell therapy where I work, and I found that they were having a lot of success with things that I thought I was potentially good for. I was a candidate for. So I called Dr. Jones, who'd done such a good job on the surgery on my knees, and he said, "Yeah, you're exactly the kind of candidate." In that he ended up taking out a lot of cartilage in my knees, which can't grow back on its own. So came in, chatted with him, ended up doing my right knee, which was a lot worse, just to see how it would take. Within less than 3 months, I was starting to notice that while I used to favor my right knee when I hiked, I was now favoring my left knee. So I knew really, really good things had happened. I went back, had my left knee done, and then all of a sudden it was like things, almost like I had almost full use of my knees back. Since that time, I've actually summited Pikes Peak. I went to A-frame and back, which is 17 miles, half up, half back, half down, so that was probably actually harder than summiting. But what I found is that the stem cells gave me, life back in my knees. And I've gone a couple times afterwards for PRP, which has really been helpful, just tuning it up. And I kind of think almost enriching the stem cells. And I know they film that now. But one of the things that really helps is that I find that after the PRP, it's like everything gets better. So that's kind of my story. I wish I had seen a video of it ahead of time, because when someone sticks needles in your knees, it's always like much more uncomfortable mentally than physically. And the idea of actually seeing it, and the first time he did it, I hit the roof. And ever since then, I've been kind of like, it's going to hurt a little bit because the lidocaine needle goes in. But after that, as long as you remain calm and keep your knee loose, it's fine. I'll head home now, but I could just as easily head